Professor John Dwyer is the founder of the Australian Healthcare Alliance. He says the new pool system is too complicated.
There are many problems with the idea of a national pool. It's extraordinarily complex and cumbersome, and it's going to require an enormous amount of bureaucratic intervention to see the money flow. I think it's not going to get up as the details are looked at. I think this is one element which will have to be simplified, and there are plenty of ways of simplifying it and keeping the aims of transparency and looking at cost effectiveness intact.
What about the new distribution system where money is allocated according to what hospitals do? Is that a workable model?
As a tool for looking at efficiency, the activity-based funding's fine. As a flow mechanism for funding local hospital networks from a central pool in Canberra looked after by, say, three wise men, that's never going to be efficient.
You talked about funding. Now the federal government is giving more, but is it enough?
It's still not going to be enough to open sufficient beds to meet the targets that are being set for the flow of patients out of emergency departments. So states are going to continue to have to put more money into this, and at least that growth funding now will be matched by the Commonwealth.
So what should the government have done?
Mr Rudd had a clear mandate from the Australian people to make major changes that wouldn't just have been about how we fund our hospitals, but would be about how we fund and operate our whole health system. We needed a new funding arrangement and we needed new models of care. And a single funder of the health system, hospitals, community care, primary care, with that single funder then passing money out to different providers who would deliver an integrated system of care so that patients wouldn't be lost in the transfer from hospitals to community to primary care. That's what we wanted, that's what we should have, and this ideally should be the start of a journey that sees us in 4 or 5 years move to such a system.
Well, saying that, are you happy then as seeing this as a first step?
As a first step, I actually think we could have done a lot more. We haven't tackled mental health, we haven't tackled dental care, we don't have a clear new model for delivering of primary care services. And we are still having the same hospital-centric system that concentrates on sickness rather than on maintaining wellness. So we could have done more, but it's good to see political agreement and the camaraderie among our leaders and the openness that came out of yesterday to looking at ideas for improving the health system. So we've just got to hope that this is the beginning of a continuous program that will improve steadily the way we deliver health in Australia.
Professor John Dwyer, thank you.
Thank you.